Okay, Stephanie also asked, can chiropractic medicine be used as preventative care for people with a family history of musculoskeletal diseases, even if they do not have any pain themselves? Well, there tends to be these familiar tendencies for back conditions. Now, not diseases. You asked about diseases. Disease, if there's some kind of musculoskeletal disease suspected, I'll send the person back to their family doctor, to a specialist. But these biomechanical problems that we're talking about, scoliosis being one of them, that definitely has familial tendencies where you'll see the spine is kind of distorted and twisted. It can be so bad that a person will need surgery at a young age, but they put rods in the spine to keep them from going too far, because it can be really disabling if it's too bad. But so things like that. No, we're not going to prevent the scoliosis, but we can help with the pain that occurs because of the scoliosis. It's hard to say what you can prevent because it didn't happen, right? So it's hard for me to answer that, to say that if your father, people come to me and say, my father had, he's laid up, he can just barely move, or my mother has these arthritic problems. What I try to do is keep the spine as functional as possible, to get those joints as mobile as possible. And if everything is functioning the way it's supposed to, you should not have any of this. And just because some gene's being passed on to you doesn't mean that that gene has to express itself. So if we get normal function back to the spine, the likelihood of you having a painful condition is much, much less. The other thing is that somebody in your family may have pain because of lifestyle, because of the kind of work he or she did. And so that's something that you can avoid, because this is actually, there's a cause and effect problem that has nothing to do with genes or familiar tendencies. So yes, the answer is yes. If we get your spine as functional as possible, you'll be much less likely to have biomechanical problems.